Thanks very much for coming. Just like to, I'm Peter Everything, Media Relations Manager for the Ministry of Health. We've got Shayne Hunter, who's our Deputy Director General, Data and Digital, and Ashley Bloomfield, who's our Director General of Health. It's Dr. Ashley Bloomfield. And I'll hand over to Ashley.
Thanks, Peter. Morena koutou. Welcome to the Ministry of Health, mana Tū Ora, and thank you very much for attending the briefing here this morning. So, as Peter said, I'm Dr. Ashley Bloomfield. I'm the Director General of Health, and with me today is Shayne Hunter. He's our Deputy Director General for Data and Digital. So, the program for the briefing is I will speak, and then Shayne and I will be available to answer any questions you may have, and then I'll be available for any one-on-one interviews you might want to do before the briefing, after the briefing wraps up. Now, as you've been made aware at the briefing earlier this morning, Tū Ora Compass Health PHO notified the Ministry of Health in early August that it had been subjected to an illegal cyber intrusion. This became evident following the defacement of its public-facing website. At the same time, the National Cybersecurity Centre, or NCSC, which is within the Government Communications Security Bureau, was notified. And the NCSC has been working closely with ourselves and Tū Ora to ensure that Tū Ora systems are secure, to investigate the incident, and to support the appropriate response. The Ministry of Health and the wider health sector take the need to ensure security and privacy of health information very seriously. Secure information exchange between health agencies is critical for the provision of modern, quality, and evidence-based health care. Now, there has been a significant focus on this since the mid-1990s, with obligations outlined in the 1994 Health Information Privacy Code, and contracts with PHOs require them to comply with the provisions of that code and with the Privacy Act 1993. While Tū Ora Compass is a non-government organisation, obviously the Ministry is very concerned about this cyber incident and its potential impact on individuals whose data may have been accessed. We have initiated several actions to assure ourselves and the wider public that all reasonable steps are being taken to ensure their health information is safe and secure. The first action undertaken was further investigation of the August intrusion on the Tū Ora website, which confirmed previous illegal unauthorised access to its systems dating back, as you know, to 2016. As Tū Ora has advised, this means data may have been accessed for up to an estimated 1 million people, and it could include data going back to 2002. While we do not know for certain whether data has or hasn't been accessed, we are working on the basis that it is likely that at least some data has been accessed since 2016. The unauthorised access has now been identified as affecting, to a greater or lesser degree, 5 Lower North Island-based primary health organisations that have a relationship with Tū Ora. As you are also aware, this illegal access is a crime and it has been referred by Tū Ora to the police. Now, once we understood the nature and extent of the cyber incident from the investigation, the second action we undertook on the 19th of September was that the Ministry of Health and the NCSC initiated a scan of the websites of all district health boards and PHOs across the country to assess whether they had vulnerabilities similar to the ones exploited on the Tū Ora website, and then to see if there is any evidence of illegal intrusion as a result of any vulnerabilities identified. That work is ongoing and is expected to be completed next week. At the same time, the Ministry asked DHBs and PHOs to assure themselves and confirm to us that their externally facing systems have appropriate security and privacy controls in place. Responses to this request are due by the 9th of October, and by yesterday we had received responses from 19 of 20 DHBs and 15 of 30 PHOs. I reiterated that request and the importance and seriousness of it during a teleconference yesterday with District Health Board and PHO chief executives. The third action we have initiated is to commission independent external reviews of the externally facing systems for all DHBs and PHOs. Now, in some cases, these organisations have commissioned external audits or reviews themselves, and we will arrange for these to be independently assessed to ensure they satisfy our expectations regarding appropriate security and privacy of information. That work is just getting underway and will take some months. We will take immediate action to address any problems identified, and we will provide public updates as it progresses. I want to reiterate the seriousness with which the Ministry of Health is taking this event and the efforts underway to address the problem and to support people affected. The Ministry established an incident management team at the beginning of last week to oversee our response, and we will continue to work closely with Tū Ora to support people affected through the dedicated helpline, which you know about, and if required, through further referral to other services. I can also assure the public that we are working as quickly as possible to ensure that similar events do not occur at other PHOs or DHBs, and we are initiating a program of work to strengthen cybersecurity across the health system so people can be confident that their health information is secure. Finally, I would like to ask the media to take care in balancing the need to inform the public with the need to not cause people undue concern or inadvertently increase the risk of further cyber intrusions, scams, or fraud. Thank you very much. I'm open to questions now.
Just in terms of the ministry, what do you know about the hacks? Do you know anything about where this came from? Any common themes, anything about them in particular?
What we know is, as you heard earlier on, there have been 4 intrusions by different actors. 2 of those would be described as hacktivists, and 2 of them by more sophisticated actors, and that's the extent of the information we have.
Do you have reason to believe that local from New Zealand or international?
I simply can't say. I don't have that information.
And you're searching with the DHBs and PHOs. Has anything come out of that so far?
Yes, so far we have had 3 DHBs identify a potential vulnerability in websites. Those websites have been taken down, I understand, Shayne?
Or secured.
Or secured subsequently. There's no evidence that any of those vulnerabilities had resulted in a breach.
Is this good enough?
Well, what is good is that we have found those and that they have been addressed.
And in terms of the wider issue with this serious breach, is that good enough? It's people's sensitive data.
Well, what I can also say is that none of those websites had any patient data on them. So those were websites. One, for example, was a website with health education information. The vulnerabilities were found and they've been addressed.
Was that the same vulnerability that affected Tū Ora or different?
Shayne, can you comment on that?
One of them is the TELAC vulnerability, which was the web hack, the one that hit Tū Ora. The other 2 I can't comment on. In terms of the vulnerabilities, I don't know. What I do know is that they've been secured or the service has been taken offline.
Could you perhaps walk us through what the vulnerability is so we might understand the issue?
I don't think it's appropriate to get into the detail. One of the issues I think you would have heard Martin say, and we believe this is absolutely the right thing to do, is to not talk specifics, because it just opens up the opportunities for the cyber criminals to go after specific opportunities. So I'd rather not go into the detail.
Just in terms of the scans, are there generally routine checks about the security of all of this, or is it just not monitored before now? And if not, will there be consistent checks, making sure everything's all good?
Yes, so I'll make a couple of comments, and Shayne may want to come in on this as well. First of all, we do require and rely on organisations, including our DHBs and PHOs, to have appropriate systems and appropriate measures in place to ensure patient information in particular is secure and private. And we require them to provide us with an assurance of that. As part of that, they should be assuring themselves and periodically getting independent audits of that. What we are doing at the moment is, with the scan, is checking their websites to see if they have similar vulnerabilities to the one that was exploited on the Tū Ora Compass website, and that process is underway. And we are also going to do this deeper review of each PHO and DHB website, and as part of that, review what future regular monitoring or auditing we might either undertake or expect those organisations to do. Shayne, did you have any further comments on that?
What I would say is that since I've been in health, which goes back to the mid-90s, security and privacy of information has been one of the top topics. And I don't think there's an IT manager or a CIO or chief digital officer in the country that doesn't worry about cyber. They do invest time and money in ensuring that things are protected, but it is a game of cat and mouse keeping up with these people. So there are also regular audits that are done, across the sector by different organisations that are either driven by external or internal audits. So it's certainly not passive. There is activity in order to protect. But as I say, it's a challenge keeping up with these people. So from time to time, things will happen.
And I think one other comment there is it's a very timely reminder of the importance of doing the basics, and in particular, timely patching or updating of software, because it was that was the vulnerability that was exploited with Tū Ora, and whilst they had the intention of updating, they were caught in that window. So it's a really timely reminder for all organisations to undertake any updating of software or patching of software as quickly as possible, as soon as any vulnerabilities are identified.
Was it acceptable that their system was so outdated?
Well, I think they opened themselves up to the intrusion that happened, and they have apologised for that and taken accountability for it.
You mentioned something about 5 practices in the Lower North Island. I just missed it. What were you talking about there?
Yes, 5 different primary health organisations in the Lower North Island, which have data held by Compass because of the nature of the different services provided. But for most of those PHOs, other than the Tū Ora Compass one, it includes just a small amount of patient information.
Which were those? What were those 5 organisations?
So the 5 primary health organisations are Tū Ora Compass, obviously, Think Health. There is Te Awa Kairangi Health Network in the Hutt Valley. There is Ora Toa PHO and Cosign PHO. In
terms of, we're obviously talking worst case scenario here because Tū Ora couldn't confirm that this data had been completely breached, and that they're just saying yes, we're doing worst case scenario. If someone in the long run who has been impacted by this does find that their identity or their medical records or whatever is used in a way that is both illegal and inappropriate, what steps, what's next, what happens then? Is there something that you guys can do?
Well, we haven't given that too much thought as yet. What we are interested in at this point in time is ensuring there's support for people who either want to know information, or if people are particularly concerned or anxious, that they can talk to someone about that. At this stage, we have no evidence either way of whether information or data has been actually taken, and or any evidence that if it has been taken, that it's been used. Obviously, if there is evidence emerging of that, then we will absolutely look at that and be working with other agencies across government to see what actions we might need to take.
Well, this is like another data breach, really. It's been a year of data breaches, hasn't it? Is there, have you got anything to say about what else could be coming?
Well, no, I can't. What I can say is that, obviously we've got a really key role to play as a stewardship role for the health system, and we've undertaken a number of actions already off the back of this data breach, which is a very significant and important one because it involves people's health information, and so that's why we've stepped up a very significant response, and we'll keep the public informed about that activity.
You were made aware of this in early August. Why did it take 2 months to let the public know?
So that's a good question, and there are several reasons for that. First of all, we wanted to undertake the investigation with the National Cybersecurity Centre to look into the breach, and as you know now, that uncovered further additional illegal intrusions, we needed a good understanding of what that was. Secondly, we wanted to then be able to ensure that the vulnerabilities identified weren't present elsewhere in the system to the extent we could, so that we could head off any further trouble. And the third thing is we really wanted to get in place appropriate support and stand up a dedicated 0800 number with people trained to talk to anyone who was concerned. So we were wanting to do this in what we'd call as a responsible disclosure, and we were well down the path to planning and delivering that. As I said earlier on, the scan that we're doing and the look at all other PHO and DHB websites is due for completion next week. We were planning to wait for that to be completed, then to go public. However, we were ready, and once the information was out there, we are now front-footing this.
The 0800 number and everything is live and active now?
Yes, that went live at 3 o'clock yesterday afternoon. So, look, if there are no more questions, let's wrap things up. I am available if you want to do any one-on-one interviews. Thank you again.
Thank you.
There's also limited availability for some one-on-ones.
Actually, can I just get